Is This Normal, Doc? A podcast sponsored by Tanner Clinic. Disclaimer: the information shared in this podcast is for general informational purposes only and should not be considered medical advice. While our podcast will provide helpful suggestions and insights, every individual's health situation is unique. For specific medical advice, diagnosis, or treatment, please contact your personal healthcare provider. Welcome back to another episode of Is This Normal, Doc? The podcast where we talk about what's normal and what's not with the expertise of our Tanner Clinic providers. I'm Hope, and I am your host.
Hi, everybody. I'm your co-host, Chelsea, today. And on today's episode, we are talking about environmental allergies with Katherine Jenkins.
Katherine, can you give us a little bit more information about yourself and what you do?
Sure. My name is Katherine Jenkins. I'm a nurse practitioner here at Tanner Clinic. I've been in practice for about 10 years, and I focus on allergies, asthma, and immunology.
So environmental allergies are so big at this time of year. My backyard is like snowing with petals for my tree in the backyard, and it's crazy, and my allergies are insane. I feel like so many people are dealing with that right now, so hopefully we can get some tips and things that can help them out, and let's get started.
All right, first question. When is Utah's biggest allergy season? Are there certain months? Is it all year? Like, what can people expect from Utah air?
So that's a great question. You can technically have allergies any time of year. In Utah particularly, people experience allergies most heavily in the spring, summer, and fall.
I feel like that's when my allergies really pick up.
At some point, though, I do feel like, when is it gonna end?
Usually
That's like
wintertime.
most of the months.
Yes, usually wintertime, but you can still have winter allergies. That's the trickiest part.
That was literally going to be my next question.
Yeah.
Can you have allergies in winter?
You can. So most people associate environmental allergies with just pollens outdoors. The thing to remember is you can have allergies to dust mites and pets, and those are indoors all the time and worsen in the winter when we use heaters.
So you mentioned dry air.
Yes.
Does that make allergies worse?
Big problem in Utah. It really affects our skin and it can affect our mucous membranes as well. So it can make people more susceptible to allergies just because they tend to really dry out in their face and their nose, which means the allergies can kind of get in there better and cause more problems.
That's a big problem for me, is I feel like everything just shrivels up and
yeah, bad skin. We have big eczema issues. A lot of people with allergies will also have eczema. And so you get kind of a double whammy in the wintertime when everything dries up and gets really cold. Yeah. Heaters are great and they keep things warm, but they dry things out a lot.
Do you recommend humidifiers for people?
A lot of people will ask me that if they struggle. Moisturizing your skin really well, moisturizing in your nose really well can help. But yes, having some kind of humidifier on your heater just helps to keep the moisture in your house. Utah is a dry climate anyway because it's a desert. Wintertime with the snow, you would think because we have moisture in the air that helps, but really it's super dry. So if people can put moisture back into their homes with a humidification system, I do recommend that.
What would you recommend putting in your nose to moisturize it? Do you use just like Vaseline or?
Yep, exactly. So usually I will tell people Vaseline or Aquaphor. I like Aquaphor because it's a little bit thicker of an ointment. You just put it on a Q-tip and you can stick it in your nose and kind of rub it around and then pinch your nose. I tell most people to do that at night just because it's annoying to have that kind of feeling of something in your nose. And you don't have to do a ton, but it's enough to kind of coat the mucous membranes in there so that as you're sleeping, especially people are nose or mouth breathers, get really dry there. That helps to keep things moisturized and kind of put that back in there. A lot of people will get sores in their nose through the winter times, and then that just makes things worse. So that will help.
What about CPAP?
CPAP. So CPAP is great. If you have sleep apnea, CPAP is helpful because often there's a bubbler or humidification system on your CPAP. So you're getting that moisture directly into your airways, which can help. The only thing about that is you have to make sure you're changing your water. And if you have any kind of filtration system on your CPAP, you got to change that because if not, then you can get allergens into there and then potentially be breathing that or mold into your.
That's always my big thing is the mold.
Yeah.
We just did an episode on sleep apnea and like sleep. We talked about CPAPs and they're like, yeah, you get dry mouth if you don't.
Yep.
If you breathe from your nose and mouth at night.
Yeah.
So that's what made me think of that.
Yep. Want to hydrate as much as possible.
So allergies and like cold symptoms are very similar. And sometimes people are confused. They don't know which one's going on. They don't know if they should go get seen or if it's contagious, anything like that. So what are your tips on
being able to tell if it's just a cold or if it's allergies.
Definitely. So I get this question a lot. We get this a lot in allergy. One of the things to keep in mind is there are symptoms that are similar. So you can have a runny or stuffy nose with allergies or a cold. You can get a cough with allergies. If you're dry enough in your throat or you have some postnasal drainage, you can get a cough, which is also happening in a cold. So there is some crossover there. The biggest thing to think about is allergy-wise, have you just been exposed to an allergen? Were you just outside and the trees are blooming? Did you go on a hike? Were you around a dog or an animal that you were allergic to or suspect you're allergic to? Did it come on quickly or did it come on over a matter of a couple of days? Allergies can kind of slowly come on, but they typically don't. That's more of cold-like symptoms.
Yeah.
A cold, and specifically, you'll get body aches, chills, fever. Not with every cold, but those are big red flag symptoms that's not allergy driven. You can get pink eye. That's just simply a bacterial pink eye from an infection. But more so with allergies, you're going to get clear drainage, almost like tears that are coming down both eyes at a time. A lot of times with pink eye, that's kind of cold driven. It starts in one eye and goes to the other. Sore throat. You can determine that again, whether are you sleeping and your house is dry? Are you sleeping with windows open? That's causing you to have symptoms. Or is it something that has slowly been creeping up and then is really intense? Something to consider.
Yeah. It was like a few years ago, and I was nannying at the time. I actually just told Chelsea this story, I think.
Yeah, you did.
But I have a point to it. So I was babysitting, and all of a sudden I just like started feeling like really gross. Like I started getting body aches and just like my body just started feeling so sick. So after that, I was like in bed for a few days, and so I was like, I should probably go get seen by a doctor. And I don't think I had any like nasal symptoms or anything like that. It was literally just like body aches, like fatigue, things like that. And I went in and got seen, and they were like, you have allergies. And I was like, I don't believe you. I was really mad actually, because I was like, what am I supposed to do with that? I literally felt like I had the flu.
So one thing I tell people too, if you're unsure, take an antihistamine.
Yeah.
It's easily done, and you can see, did that improve your symptoms? If it did, then it's more likely to be an allergy. Even if it's a cold though, and it's just helping to drive your secretions, do you feel better? Sure. And then if you are unsure, go see a provider and or come get allergy tested, and that will help you know either way. Yeah. With allergy testing, it gives you a better idea of when potentially you may have symptoms like this, so that if something like that were to happen in the future, you would know better how to handle it.
Yeah. It just really made me mad. I was like, I don't know what I'm supposed to do. Didn't have any allergy symptoms, but
You did.
who knows? I should probably have gone to an
But
allergist.
body aches and chills, I mean, that's not common. So that does sound more like a cold.
Yeah, that's what I thought.
Yeah.
I didn't trust them.
Yeah, that's not going to cut. You're not going to get body aches and chills with allergies unless you have a cold from your allergy symptoms. That can happen.
Really?
Yeah.
So allergies can cause a cold?
Allergies can cause inflammation in your face, mostly your mid-face. You can also cause you to have asthma if you have allergy-driven asthma. So you can have allergies that flare, and then because you're not controlling your histamine response and you're getting inflamed all over, you can then pocket bacteria certain places, or even viruses that then can cause you to be sick. So kind of two things happening at one time. And symptoms have crossover, so then that can be confusing.
Can allergies cause you to have a sinus infection?
So technically, yes. Again, if you have allergies that are not controlled, so you're not taking medication or doing allergy shots, you're having constant inflammation up in your sinuses, then yes, over time, if you have too much inflammation in there, especially if you have severe congestion, then what happens is in those sinus cavities, you can get viral or bacterial infection in there that then sits in pools, causing you to have a fullness in your face and a lot of those symptoms. Predominantly, if you treat your allergies, most of those are viral and will go away on their own. People prone to sinusitis may need to have antibiotics after they have that buildup of infection. But most of the time, I just had a text message from a family member just this weekend telling me that they thought that they had a sinus infection that was brewing. And I said, well, I don't usually treat anybody for a sinus infection unless it's been 7 to 10 days because most sinus infections are viral. I said, given the time of year and the symptoms you're having, I bet you have uncontrolled allergies. He agreed that he probably thought it was allergies, but was concerned about sinusitis, which is normal. People who have that tend to understand exactly when they're getting it. But we talked about a regimen of antihistamines and other allergy medications. And he texted me 2 days later and said, "Oh my gosh, you're a genius. It was allergies. I feel so much better. Thank you." And we drove on. So we not only fixed his allergies, but we saved him from taking an antibiotic that he didn't need.
You're like, yeah, that's my job. I am really smart.
I've done
Thank
this
you.
for years. This is what I do.
You're like,
so.
trust me, I know what I'm
Right.
talking about.
Yep.
So you're talking about your family member who thought they potentially had a sinus infection. So there is obviously a lot of crossover symptoms. Can you kind of pinpoint what are common allergy symptoms that people would experience?
The most common symptoms that we typically see are itchy, watery eyes, nasal congestion, and drainage, which confuses people, but you can be both congested and have drainage. Sore or itchy throat, which is from postnasal drainage, and then people will often complain of itchy ears. So I will usually say, is your ear bothering you? And you kind of want to do that scratch. Those are the most common symptoms. And then even, again, dry skin, eczema can be a sign.
What about I sometimes I'll get like swollen lymph nodes. Is that
Yeah.
a symptom of allergies?
Potentially, it could be more an irritation of your immune system. That would lead me to think maybe that your symptoms are related more to a cold, a virus, or bacteria. But yes, you can have some of that. A persistent cough also, or throat clearing, a tickle in your throat. That can be another sign too.
Yeah. I usually get a dry mouth and a dry throat, and then that makes me have to like cough.
Yeah,
Little
again,
bit.
so along with itchy, watery eyes, you can get some eye dryness or irritation. And then, yes, you can get irritation, again, all along your mucous membranes. You're breathing in all of those things through your nose and your mouth. And then with Utah's dry air, even wintertime is worse for that. But spring, summer, fall, that can happen all the time then too.
Can you develop new allergies as an adult, or do you kind of figure out all your allergies that you will have as a child?
No, you can absolutely develop new allergies anytime. So we'll have people that will come in and were diagnosed with allergies as a child. They had a full either skin panel or blood work done. And then even some of them have gone through some form of treatment. And then later on in life, especially like women post-pregnancy, your body changes a lot with pregnancy or hormones. You can have changes at any time. So women will come in, men too, but you can see changes into adulthood. We even have people into their 60s, 70s, and 80s that come in and have new allergies.
That's crazy to think that you can be that far in life and then something pops up and that you've never been allergic to and now you are.
Yep, your immune system is always changing. So you can always have something pop up.
The more you
People
know.
tend to have more I feel like people tend to have more allergies when they get older.
Yeah, I would
So I don't remember really having bad allergies when I was younger.
Yeah.
we have a lot of, I would say, people in their young adult to mid-adulthood who come in and say that exact thing. I was fine, or I didn't think I had problems earlier in life, or they just, it kind of was their status quo. And so they were used to however they felt. And then as they've gotten older, things have changed. And then they feel like they're stronger and stronger. And as the years go by, they get worse and worse. So we will often tell people that when they come in and they just want to know, we'll say, okay, here you go. But just so you know, if you don't treat them, the potential for them to get worse as each year passes is there.
So for someone who's experiencing bad allergies or feels like they are experiencing bad allergies, how do they go about getting tested for them?
So you can call and make an appointment with one of the providers in allergy. We have 2 options to figure out what you're allergic to. Typically, we will do skin prick testing, but you have to be off of antihistamines or any medications containing antihistamines for at least 5 to 7 days beforehand.
Okay.
For the people who struggle with that, then we have blood testing that we can do. So we draw your blood and we look at the same panel in your blood work. The benefit to skin prick testing is that we get to see answers immediately, and we can talk about those specifically right at that appointment.
Yeah.
Blood testing takes a week or 2 to get those results back. And so then typically we have to have another appointment. But either way, we can get you answers and then you can see what you're allergic to.
How do you treat environmental allergies? Is it just with taking allergy medication, or is there more to it?
So there's kind of 3 different things that you can do. One is avoidance, but that's really tricky. Unless you're the bubble boy, you can't really avoid allergens in your lifestyle. And I will tell people that I still want you to be active and be outside, have pets, do all the things that you love. But if you have allergies, you have to take that into consideration. So we have 2 different ways in our clinic that we treat allergies. We either will give you a medication regimen, and that can be just basic 1 antihistamine to a series of things that we can use, or allergy shots. When I talk to patients about this, I usually say that medicine is helpful, but it's kind of like the Band-Aid on a wound that needs to be stitched, whereas allergy shots is the thing that will fix and desensitize you for long-term benefit. So that's more like the sutures of a wound to kind of fix things long-term.
I've heard people say, like, if they're around an animal for a long enough time, they don't feel like they're allergic to them anymore. Is that true?
So that can happen. I had that happen with my own son. We had a dog forever from the time that he was born, and he didn't really have any issues. Then that dog died unexpectedly, and it was about a year before we got a new dog. So everyone in my family had been fine up until that point. He was a toddler, maybe 2 years old when we got this new dog, and he just started having all of these issues. And turns out he was allergic to this dog. He'd been so used to the one we'd had before because she was around since birth, and then had that break. And then we got a new dog, a different breed, and he had massive issues. So yes, if people have been around an animal in their house long enough, they will kind of slowly desensitize themselves, which is what allergy shots do, just with more intention and at a faster pace. But yes, you absolutely can be desensitized to something. It just probably is a more miserable process.
Yeah, and like I feel like it would take a while to become desensitized to it,
Definitely.
and you'd be miserable.
You love it enough.
If that's
You
true.
will suffer.
Commit.
Yes,
True.
if you are a
true.
pet lover, you
People-
will suffer through it.
There are a lot. Kids are really motivated to do allergy shots when it's for a pet that they really, really want.
You know what? That's fair. I could see that. I like animals, so I'd be like, okay, give me the shot. I'll take it.
My dog is my life. I love my kids and my husband, but we always joke that she is like the number one. If I was allergic to her, I absolutely would do shots because I can't live without her.
Yeah, it's fair.
So we've been talking about allergy shots. I used to work as a receptionist at Tanner Clinic, and at one point I was checking in people. I wasn't at a set desk at that time. I was moving around, so I wasn't used to like the schedule of allergy shots. And one day I had to work at a desk that did allergy shots, and I was like so overwhelmed. But it made me curious about what they are. And so can you kind of walk us through, like, when someone is doing allergy shots, how often are they coming in? What's the process for that?
So the process for allergy shots goes back to what type of testing that you did. So we take either your skin prick testing or your blood work, and we break down exactly what you're allergic to. So of that panel, your trees, your grass, your weeds, your molds, your animals, your dust mites. We take those and then we make specific serum for you. So it's not a one size fits all. Everyone's serum is individually different, specific to whatever you're allergic to. We put those in vials, and depending on the number of allergens kind of determines the number of vials that you have. Once you have completed the forms that you need to when we make those vials, then you have two different ways that you can do injections. We have a standard and a cluster. Both of them get you to the same endpoint. Cluster just gets you through faster. Standard, you can come up to 2 times a week to get your injections. You're only here for about 20 to 30 minutes every time that you come, and then you're able to go home. If you decide to fast track with the cluster protocol, then you're given a series of medications that you take the day before, the day of, and the day after your injections. And you do multiple injections at a time while you're here for 5 weeks, but you're pretty close to that maintenance dose by the time that you're done with your clustered injections. Then once you're at maintenance, you're doing that for about 3 to 5 years. I try to give people the expectation of 4 to 5 years monthly that you're coming in for a shot. But if you think about the benefit that you're getting from injections, 1 time a month for 20 minutes for 4 to 5 years is nothing compared to the suffering that you're doing spring, summer, fall, even wintertime, year after year after year, especially if your allergies get worse year after year. So either way, you get to the same result. Standard is just if someone has a really tight schedule and they're not able to come here for a couple of hours, 5 weeks in a row, then they can come kind of around their schedule. Our clinic is open from 7:30 to 5. So anytime in there you can make appointments, and then you can schedule them ahead so that you can work around anything. If you have vacations or other things coming up, then we can work around that too.
That's awesome. I didn't realize you did like a specific like cocktail. I don't know how you, that's how you would put it, but
Yep.
that's really
So
awesome.
the benefit, the benefit of allergy testing is, one, then you know what you're allergic to and what time of year those things are blooming.
Yeah.
If you're allergic to trees, you've got those spring allergies coming right out of winter. Grass, that's more of your spring, summer. Weeds, that's your summer, fall. So yes, you know that. But then when we're making your serum, we have it tailored specifically to you. So we're treating all of those things so that you're getting benefit from each one of those. So you're feeling better all the year round.
That's awesome. I mean, that's so worth it for someone who's like really struggling.
Yes.
Yeah.
People see huge benefit from it.
I just think, especially with like little kids, you know, like if they are allergic to an animal and they go to someone else's house, like the risk that can happen with little kids and allergies. Like, I feel like that benefit is huge.
Absolutely. So my son that I was talking about, so he was 2 when all of that started. He had several years of really severe asthma and hives that would happen, and it was really scary to send him places. One time I let him sleep at my mother-in-law's house, and she had a dog that was bigger than he was, and he walked by and licked his face, and his whole face puffed up. Because when you have allergies, you're allergic to the protein. So for animals, it's in their saliva and urine. So spoiler alert, there's really no such thing as a hypoallergenic pet.
I've
Just
always
throwing
thought
that out there. There are animals that don't shed dander, right? A hairless cat, but a hairless cat still pees and has saliva in its mouth and licks itself all the time. So that's one thing to keep in mind. But my son struggled for a long time. I just recently started him on allergy shots, and it's game changing.
Yeah.
That's going to blow people's minds.
Yeah.
I hope you know that.
Oh, I know. It is the one thing I try in most of my visits to really kindly correct people when they say that. But even out in the real world, I'll be in a checkout line and hear someone talk about it, and I'm always like, oh. That's not true. Again, my dog that I have, she's a multi-generational golden doodle, meaning she really doesn't shed at all. I get her groomed every 6 to 8 weeks, depending on the time of the year. But how do animals clean themselves? They're licking. So they're putting that allergen on their fur, and then that's being shed. Or if you're like my kids or me, and I'm just excited and rubbing my face in my dog, then it's all over me. And you can see some allergens, you can see some pollens, but you can't see all of it. You can't see animal allergen. So there really is no such thing.
I definitely have heard that, but I was like, oh, that's interesting. But
yeah, they say hypoallergenic because they're non-shedding. It's like a hairless cat. It's not going to be dropping any dander. So sure, you have less exposure to allergen because it's not all over your house. I have friends who have shedding dogs and there's hair everywhere, right? You sit down, it's covering you.
I'm like Hope's been to my house. I have a black lab and she sheds.
Yeah, they shed everywhere.
So,
so you're taking that home with you wherever you go, right? You're then dropping those wherever you're at. But the reality is even the dogs that don't shed or don't have hair still have those same allergens. Mind blowing.
I know.
Literally.
People are going to be shocked.
They are.
You heard it here first.
So we've talked about shots. Obviously, there are so many over-the-counter medications that you can get. Do they work? Are they just kind of like putting a Band-Aid over a wound? Are they worth buying, or should you look into stronger things like shots?
So absolutely. Antihistamines over the counter are first-line treatment. I use them in my own family. I think they're great. I will say that I have some preferences over others. Allegra, Zyrtec, those are my number one, and you can do the generics. So the generic of Allegra is famotidine. The generic of Zyrtec is cetirizine. You can do either or both. Allegra is probably my number one just because it really has no side effect profile. I would say 1 in maybe a couple thousand patients that I see, someone will come in and say they have something with Allegra that they don't like. Otherwise, it's a great medication. Zyrtec is equally as great. The only downside to Zyrtec is sometimes it can make people feel a little bit sleepy. So the example that I usually use is I give Zyrtec to my kids all the time. I gave some to my son last night. I give it to him in the morning. Fine, they don't have any issues. I took it once at work because I thought I was having a reaction to something. So I took it in the morning, and by the afternoon, I felt so tired. Not like Benadryl. Benadryl really causes a big somnolence effect or makes you feel like you're sleepy or drunk. So we do not use Benadryl in our clinic. That's kind of controversial, but there are studies out there that show that you have less reactionary time when you're using Benadryl than you would if you had had some alcoholic beverages. So we don't use Benadryl in our clinic. Zyrtec and Allegra are probably our number ones. There are people that really like Claritin, but in general, most of the population does not have near the efficacy from Claritin as they do from Zyrtec or Allegra. I just told this to someone earlier this week, and or a couple weeks ago, they came back to see me this week for an appointment, and she said, "Oh my gosh, you were right." She's like, "That was game changing. When I switched my antihistamine, I felt so much better." If Claritin is the one for you, loratadine is the generic, that's great. Also, if you try a brand name and you don't feel like it's as effective, try the generic. They are a tiny bit different and you may have some benefit from the other. There are also patients that will try one for a year or two and then feel like it loses its efficacy. So then I'll tell them to switch to something else, and then they usually will get better efficacy from that one.
And like I have heard that you can build a tolerance up to different medications. So.
Most people I would say don't, but for the people that do, we just have them switched. And then there's over-the-counter nasal sprays, like Flonase is a great one, and that helps kind of give you your benefit right on your nose, or eye drops. Those are good too if you need just that immediate benefit to a specific part.
One year I got really bad vertigo and I couldn't get out of bed. And I was assuming it was because of my allergies. Maybe you can clear that up for me. But I was told to go to the pharmacy and get Allegra D, like a decongestive one. Pretty intense stuff. And that helped me quite a bit. Is that something that you recommend? And is vertigo something that you associate with allergies?
So I don't necessarily think the two of them go hand in hand all the time, but yes, I have seen that. It's typically because you experience some eustachian tube dysfunction, which causes your vertigo. When you take a decongestant, which is what the D is in Allegra D, Claritin D, Zyrtec D, when you're taking that medication, it opens up those eustachian tubes, which helps to equal out your balance and makes things better. The downside to Ds, sometimes people get addicted to how good they feel on decongestants. They get very clear and open, and then when they go off, they can have a little bit of a rebound effect where they'll get more congested afterwards. Decongestants are good short term. Long term, they can affect your kidneys and your blood pressure. So yes, they're great, and if you have vertigo, absolutely you can use it. I just would make sure you use it for a short time. Yeah. So use it interwoven with just regular Zyrtec, Allegra, whatever your antihistamine of choice is.
Yeah, and I couldn't stay on it very long. It made me very thirsty. I could not drink enough water.
Yeah, it can cause some fluid retention. So it can make you super thirsty. It can cause urinary retention. So there are other, again, side effects to using it. It has its place, just not consistently. And it's behind the counter. So you do have to have a driver's license in order to get it.
And there's reasons for that.
There are reasons for that.
So we won't go into them here. Another question that we've gotten from people is it possible to quote unquote allergy proof your home in any way? It's not, I mean, I know we can't all be bubble boy like you mentioned earlier. I mean, that would be ideal, just be in a bubble, no allergens. But is there ways that we can at least alleviate that?
Absolutely. So the things that I typically tell patient are, number one, change your filters. So filters usually should be changed every 3 months. Every filter is different, and there are some that tout like year-long, 6-month-long. I usually say at least every 3 months. If you could change it monthly, that's better. So those are your furnace filters usually in your ceilings.
Yeah.
You can also do things like put allergy filters or HEPA filters in your house that can try to pull allergens out, and then also put a bubbler humidifier in your system. The easier ways to do that if you don't have the money to be it's not as cost effective. You can do things like just not opening all your windows. So I don't know about you guys, but when spring comes, I'm like, great, open everything, air it all out, because winter, everything kind of gets stuffy and you feel musty. Yeah. The problem with that is if you have allergens, some pollens are too big that they can't really be carried on the wind and get through, but others are not. They can get in, and then all you're doing is inviting all of that allergen into your house. Additionally, driving with the windows down can do that. So any kind of direct contact.
I love that too.
Right? I know they're all the things that we classify with spring, summer, fall. Like we just, especially in Utah, it's beautiful here. We love to be outdoors. So again, I don't want to discourage people from doing that. The other thing that you can do is just make sure that you're laundering and showering regularly, which I know, again, it's not mind-blowing, but it is something to consider. So if you are a person that is outside all day during the day, you're probably going to want to switch to being someone who showers at night. Why? Because I can't necessarily see all of the pollens that are on you from being outside. If you could, you'd be horrified. Yeah. And you would for sure shower every time. But what you don't want to do is be out of doors, going on a hike, taking a picnic, riding a horse, whatever it is you like to do. Then you're coming inside, you're laying down on your couch or your bed, you're snuggling your face in it, and then all you're doing is breathing it in all night or rubbing it on yourself all night. So that's a big problem. Yeah. So I usually tell people laundering your sheets weekly, changing your clothes. If you've been outside and you have severe allergies, come indoor, wash your hands minimally, avoid touching your face so you're not getting it in your mucous membranes. And then making sure you're showering at night if that's the issue. And then your pets, it's the same thing. If they go out of doors, they need to be bathed regularly. So they are also not coming in and dropping that all over your house.
Makes a lot of sense. I never thought about the showering at night, but that actually...
Yeah, so if you're going out of a door, again, Utah's beautiful. My son loves to hike. You get home and you're super tired. So the first thing you want to do usually is eat, drink something, and then like lay down. But the problem is, again, you're dumping those and then they're there and then you're bugging yourself and you don't even know it. So if you can switch to being a nighttime shower, at the very least rinsing off.
Yeah.
But I will tell people, wash your face, wash your hands minimally. But if you are out during the day all the time, then switching to showering at night is going to be beneficial.
It makes sense.
Yeah. Helpful tips.
Yeah, you just don't ever think about it.
You don't, and we all want to enjoy all the things.
Yeah.
We want to open our windows. You just have
Oh,
to
yeah.
be careful because it does definitely ramp that up.
I feel like especially like I have 3 dogs.
Mm-hmm.
I live in a zoo, we always joke. But so as soon as it's warm enough, I want the windows and the screen door open because they get stinky and it's been winter and they come inside wet and
Yeah.
but then
You don't want to be nose blind, but also
Yeah.
you're inviting all of that in. So again, changing your filters, keeping things out if you can, but still enjoying your life.
Okay. So we've talked about having a humidifier and how that can help. Do air purifiers help? Do they work? Are they just kind of a scam? What's your thoughts on those?
I think they can be beneficial, again, if you're doing what you can hygienically to keep them clean. A lot of my patients will buy the big air purifiers and have them in a main open concept space, and then others will buy smaller ones to put in individual rooms. I think they can be beneficial, but I also think, again, if it's not cost effective for you, taking those other measures can be just as beneficial. The other thing that can be helpful too is to clean out your air ducts. So there are companies that will come in that will suck your air ducts out. I will say that I think that to some extent they can't get everything, right? Unless you have a new build, I don't know that you can eliminate everything that's in your home.
Yeah.
Changing carpet out if it hasn't been changed, that's another thing. If you have hardwoods, it's better than having carpet that's going to kind of absorb things, and it's more difficult to get that deep clean. That being said, I love carpets in bedrooms and main living spaces that are cozy. So it's kind of having a balance. If people want purifiers, if they're still struggling in addition to doing all of those other things, I absolutely think a purifier is great. Is it perfect? No. Do you need to spend tons and tons of money? I don't think so. If you can afford to get a system on your house that can purify and humidify, that would obviously be optimal. But for cost, even just something you can plug into a unit that you can either move or that can just control that space is good.
I live in a very old house, and when my husband and I bought it, we did like clean out all the air ducts and we found cigarette butts and like cartons of cigarettes like shoved down in there, and I'm like, oh my goodness.
Who are those people doing?
I know.
Yeah,
Well, and I'm
right?
like, if we
Party
didn't
hard.
clean those out,
Yeah,
our
you
house
would
would
be
have
blowing
probably
that.
smelled like cigarette smoke.
Yeah. In addition to all the other fun
Things
down there.
Yeah.
Yeah, I don't think it's something that needs to be done necessarily yearly unless you're really filthy person. But outside of that, I think, every 5 to 10 years doing that and then taking the other measures that you can just to keep things clean.
So as far as Utah-specific allergy concerns, we live in a valley. We have inversion. Does that have any effect on our allergies or asthma, anything like that?
Allergies, we have the same kind of in the Intermountain West. We have the same kind of foliage that's around, but we have a lot of patients that come from out of state into Utah and they are a mess. So yes, Utah-specific allergies can be pretty severe here.
Yeah.
Part of that is just because we have a lot of beautiful nature surrounding us, and that's amazing. The downside to that is people can have a lot of significant allergies. The other thing I'll say is that people will live here and then they will either travel somewhere or move somewhere temporarily and then come back, and it's the same thing. I was fine when I was in Florida, Hawaii, even the Midwest, back east, and then I came back home and I'm a giant mess and I can't fix it. It's Utah. Definitely.
Love it. But
Love it.
there's
We have lots of
downsides.
trees, grass, and weeds here. We love to be out in them. Utah's beautiful. We want to enjoy it, but there is that downside. So that's why if you do the work to figure out what you're allergic to, then you can know preemptively how to treat it
Yeah.
and still go out and enjoy your beautiful life.
Fun story. I was living outside of Utah for a while and I was like really missing home. And one day I like drove back. It was like hours of driving. And then I went up my street and I saw the mountains and like the trees on my street. And I like literally cried.
Oh, yeah. It's
I
so
love
right.
it here. There's downsides, but it's
There's
really
downsides,
pretty.
but it's beautiful. We have a lot of patients that actually come for treatment for different things from out of state or out of country. A lot of them end up permanently relocating here because they love it. It's so beautiful, and there's so many things to do within not very many hours of where we live, which is fantastic. But then we often will see them back because they have this facial misery, and we can fix it.
we're not here to like promote Utah or anything, but we
It's
do
a
have
place to live.
we have a bias
We
for
do.
sure.
We love it here.
So another Utah question, are the native plants here better for allergy sufferers? Do those plants not affect them as much because they're just used to it and they've lived here their whole life, or do those plants still affect them?
That's a good question. There are some people who kind of have that desensitization we talked about earlier. They've lived here their whole lives, so they're used to that. A lot of times they just know that that's their status quo, but over time things get worse. So by the time they hit adulthood, they feel awful. Some people will come in and say, I've never had allergies my whole life and now they're terrible. It's usually because they probably have. They're just used to them because they've grown up with them their whole lives. Other people don't have allergies. So living in Utah is great. Utah has things specific again to the Intermountain West region, and those will be different in other places. Are they better or worse than others? It's hard to know. It just depends on the person. Everybody has different things. Everybody has different DNA, which is why we tailor our allergy shot serum to each person, because some people may have more allergies in one realm than another, may have severity to grasses. We do have high grass here in Utah, so grasses tend to be a big problem for people here. So that's something to keep in mind. Outside of that, you're going to have, it's a mixed bag. People who grow up here and don't have any allergies, people who grow up here and have some allergies, people who grow up here and are a mess.
Those people without allergies must be nice.
Oh, just kidding.
The allergist that doesn't have
I
allergies.
don't have allergies, but my kids have terrible allergies. So I do commiserate.
I'm so happy for you.
Right? I have terrible sinus infection. I have a terrible immune system. Does that help?
Yeah, that makes me feel a little bit better. But
I have a garbage immune system. It basically has Alzheimer's, so I don't. My body doesn't remember any illness that I get. So it's cool.
Starting fresh every time.
It is. It's great with little kids.
Just to finish off, I wanted to ask you if there's anything that you hear commonly in your time practicing that's maybe not true, or just something that you hear a lot that you want to give us some insight on.
Hopefully, I won't get raked over the coals for this, but local honey is a common misconception. So if you don't know what local honey is, it's where people will buy honey specifically locally made in order to hopefully get kind of that desensitization to the local flora and fauna through eating tasty honey. The reason why that's really not true is that pollens are heavy and those cute little honeybees don't really carry them. While they do pollinate and they do the work with honey, they're not taking mass quantities of those in a way that's going to affect you that way. So eat your local honey because it's delicious. I love honey. My neighbors behind me are beekeepers. I think it's fantastic.
Support local business.
Support local businesses. Yes, I love to support local any way I can, especially in the spring, summer, fall with farmers markets. And I do think people make really tasty honey. Is it going to give you those kind of antihistamine, anti-allergy properties that you're expecting? It's not.
What about bee pollen? There's like the pollen. People have been
Yes.
pollen.
People like to take that and like do it on their lips, right, for the plumping effect. Have you heard of that?
No.
That's a thing too. We didn't ever talk about venom allergies on here, but there are legit venom allergies, and that's another thing you just need to be careful of. You're not going to necessarily get that with exposure to honey, but if you're truly touching bee venom, that's a whole different thing to consider.
What about like so people take bee pollen for the anti-allergy properties?
Yeah.
Is that still not a thing?
Yeah.
Okay.
Yep.
Just curious.
I mean, that's great. I'm all for supplements. I love supporting local. Just make sure, the other thing too is just make sure you know what you're ingesting just to be safe. It's delicious honey. I'm not knocking that. Is it going to make a huge difference in your allergies? It's not. So if people are buying it by the drove, spending hundreds of dollars on it and expecting to have a huge difference, it's not going to be what they were expecting.
Bees are still great.
They are
You
amazing.
can still
Honey
love
is
bees.
delicious. And you beekeepers, keep it up.
So I'm curious more about this bee venom stuff.
So people will use it as like a natural Botox. And they typically will inject it in the lips because people want plump, full lips. You just have to be super careful because you can be allergic to bee venom. Yes, there's a whole bunch of people who are allergic to a series of our mixed vespids. So wasps, hornets, bees, yellow jackets. You just have to be super careful, and you are injecting it into your face. So if you have any kind of issues, you could potentially go into anaphylaxis.
So maybe they should come in and get their allergy testing done.
Get your allergy
Sure,
testing
yeah.
done. You know,
Plug for
if
you.
right? If you want to have those pumping effects, maybe see someone who does legitimate Botox or Dysport.
Yeah.
Just be super careful. That's my biggest thing. You can sensitize yourself to something. So maybe the first time, this also happens with stings, the first time that you are stung or you inject that bee venom, you may not have any issues and things are fine, but your body can then all of a sudden be heightened and aware of what just happened. So then the next time it happens, you can develop an allergy and have a lot of anaphylaxis. So you got to be super careful in what you're doing.
Have your, shot nearby.
pen ready.
Yep, keep your
I know.
pen on hand.
My cousin plays college football for a team in South Dakota, and they're known for having a lot of yellow jackets, and their mascot is a yellow jacket. But we were at one of his games, and he got stung in the mouth on the tongue by a yellow jacket, and he swelled
that's
up. His
huge.
tongue was huge. So, like, the thought of, like, even putting that on my lips freaks me out because I've seen it in the mouth, and that does not look fun.
Yeah, no TikTok trends.
Yeah.
Go see your local provider if there's
We've talked
something
about that
you've done.
before.
Yeah.
You can do budget-friendly things. Just
There-
make sure you're getting them from a trustworthy source.
So that's the thing is I tell my patients all the time, I don't ever want to prescribe or encourage someone to take something that I don't think that they need. But safety is key. And when you come to see me or any of the providers here, our goal is to give you the best care as possible in the safest environment. So I will tell my patients the most control, least amount of medication is pretty much how I practice medicine. And I get it. We want to look beautiful. We want to feel good. We want to enjoy life. The caveat to, and we don't want to spend a lot of money, especially in Utah. There's a big drive for that here. I get it. I get that 100%. But if you're doing something that's a little bit sketchy and then you end up in the ER spending thousands of dollars for treatment, was it worth it? You have to be really careful. So make sure that you're educated, that you're looking at the right sources online. And if anything, come in and ask for a provider. That's what we're here for. That's what we went to school for. That's what we do every day for our practice. So when you're researching, Google AI, ChatGPT is not always your best friend if your information isn't correct. So just make sure you know what you're doing and you're safe about it because that's our goal for you as a provider.
Once again, I say this every episode, don't go to the internet.
It's not your best friend.
Yeah.
Huh.
Dr. Google, Dr. WebMD.
You're not dying at all times. Yes. True. Well, thank you. I appreciate you. I think you gave us some really big, mind bombs there. For those of you who are watching and listening, this has been Is This Normal, Doc? If you want to follow us along on our journey, you can follow us on our Tanner Clinic social media, and we post questions on there regularly for you to go on and answer for our next guests. So be sure to do that, and we will see you next time.